I'm Dr. Andrew Webster. I'm the Head of Clinical Governance at Dilba Health Service, and I work here in Darwin on beautiful Larrakia country. And Dilba Health Service is the Aboriginal and Torres Strait Islander community-controlled health service for the Darwin and Palmerston region. The vaccine for COVID-19 is extremely safe. It's been tested in a variety of different ways around the world. Also, hundreds of millions of doses have been given already around the world as well. We're at the start of our vaccination journey here in Australia, but we've got all of this fantastic information from how it's been used in other countries to let us know that it's a very safe and a very effective vaccine, and I think people can feel very reassured by that. Not only should they feel safe, it's actually even more important for people with pre-existing conditions to get the vaccine. We know that people with things like diabetes or heart disease or lung conditions are at increased risk of getting very unwell from COVID-19, ending up in hospital and also dying. And the vaccines absolutely do prevent that. So vaccines that we have against COVID-19 are extremely effective at preventing you from getting seriously unwell. They may not stop you from getting any kind of COVID-19 illness. You might still get a mild illness, much like can happen with the flu, but they're extremely effective at stopping you going to hospital or dying from COVID-19. And ultimately, that's what's really important about protecting yourself, but also protecting your family and the loved ones in your family or your community. We've started rolling out in the Northern Territory the Pfizer vaccine. That's not available to most people. I won't be getting the Pfizer vaccine. It's only for people who work in border security, quarantine facilities, aged care facilities and aged care staff. So what most of us will receive, and that includes me and other healthcare staff at Dilba, will be the AstraZeneca Oxford vaccine. That's likely to start rolling out from early March and we'll start to be receiving it in Darwin, I would say, by the end of this month, by the end of March or early April. Yeah, so as I said, right now we're already doing 1A, so that's those particular high priority groups like quarantine workers, border security, but then also aged care residents and aged care staff. After that, the next group is what's called the 1B phase of the population, which includes Aboriginal and Torres Strait Islander people, but also other healthcare workers and other priority groups like people who work in higher risk environments, which includes some people who work in hospitals or other types of care occupations. And then after that, phase 2 and so on is the rest of the population. The way that it's been done is to try and prioritise those who are most at risk of getting very unwell from COVID-19 if there was an outbreak, and also protecting that workforce who are likely to come into contact with people with COVID-19. It's a great question. So people in remote communities absolutely can still get the vaccine in their community. So we won't, as Dilba, be delivering that, but local health centres, whether they be government or community-controlled health services, will be delivering the vaccine. In instances where neither the local clinic, where the local clinic can't provide the vaccine, the Commonwealth Government, in collaboration with the Territory Government, will provide the vaccine. And that might include sending people out on a plane to provide the vaccine. Well, there's a variety of other ways to do things, but I think communities and individuals can feel confident that they will have access to the vaccine. And some of the detail is, of course, still being worked out about that. But I think it's really good to start talking to your health staff in your community about how that's going to happen. It's absolutely not compulsory. It's really strongly recommended, but it's not compulsory. And I know I've heard this in the community. I know people are worried about whether there might be implications on things like Centrelink payments and that sort of thing. And I've asked this question of the Commonwealth Government, and I've got a very strong answer that it will not be made compulsory, and there's not going to be any link towards payments or benefits or anything like that. I think people can feel confident that it is their choice, that the reason to make the choice is because they should hopefully know that it's going to be in their best interest in terms of their health. But also, as I said before, it's not only about your own health, it's also about trying to protect the elders in your community, or people who might be unwell, or people who might have chronic diseases in your family or in your broader community as well. Because you getting the vaccine will help protect them from getting unwell as well. Yeah, it's a great question, and I'm hearing this a lot as well. So at the moment, young people under the age of 18 aren't eligible to receive the vaccine. That might change as we get further along this journey. Some people in other countries are starting to vaccinate people under 18 and to 16 years old, but that's not very many people at the moment. Not many countries are doing that. The reason for that is for two reasons. The first is that young people don't seem to get very unwell from COVID-19. So there's been very small numbers of young people getting sick, ending up in hospital or dying from COVID-19. They just don't seem to be as affected as badly by the virus. And the other reason seems to be that young people don't appear to spread the virus as much as older people as well. So when you're in that 0 to 18 age bracket, you don't seem to shed as much virus. That means you're not putting as much virus out into the air when you're breathing out as someone who's in their 20s or 30s or older might do. So therefore you're less likely to get unwell, but also less likely to make other people unwell when you're younger. That doesn't mean it's impossible, but it's just less likely. And it's something that we're going to continue to watch and see what other countries do. And then further down the track, if there's a good reason to vaccinate people under 18, then they'll be included in the rollout. So Danila Dilba is providing the vaccine to the Greater Darwin and Palmerston area, which is where our clinics are and it's where our community is. Other communities will be serviced by either their local community controlled health service or government health services. And it'll depend on where you are as to who's going to be delivering the vaccine, but it's almost always going to be delivered by your local health service, and they're going to be the ones who will know about the details of the rollout, how it's going to happen, when it's going to arrive. So in Central Australia, in Alice Springs, it's likely to be Congress is going to take a key lead role. And then in other communities, East Arnhem will be MeWatch and others, depending on where you live. The thing that I always say to people is if you're after something to do with health advice, talk to a health professional, someone who's done the training, done the time to be able to understand what they're talking about and knowing a lot of knowledge about what's going on. So talk to your local health staff, so be that a health worker, a nurse, a pharmacist or a GP, and go and talk to someone in your local clinic about it rather than looking at things on the internet, which may often be written by people who have no knowledge of the science or of the health implications of the vaccine and might just be doing it to get some publicity for themselves or to create fear. So if you are worried, and I do understand that, I understand that this is new for a lot of people and there might be some fear, then go and talk to someone that you trust who has some health qualifications in your local health clinic about it. That's right, so for the COVID vaccine, there are 2 injections that are required for all of the vaccines, and that includes the one that I'll receive and that most of our clients will receive. So the way that it works at the moment, the recommendation is that you get the first vaccination with the COVID vaccine, and then up to 12 weeks later, you get the second dose. So there's a 3-month interval between those 2 doses, and that's what gives you the best protection. The other really important thing for people to know, and what I keep talking to people about as well, is the flu vaccine. Because of course, we can't forget about the flu vaccine this year. Flu is a really important illness that still harms a lot of people in our community. And there will be a flu vaccine coming out in April, as it usually does every year. And it's really important that people think about getting that flu vaccine as well as the 2 COVID vaccines. You can't get them on the same day, that's really important. So you get the COVID vaccine and then up to 2 weeks later, you can get the flu vaccine. But I think it's really important that people gear themselves up to think about getting 3 vaccines this year. That's the 2 COVID vaccines and the flu vaccine. Yeah, so people might be worried about there being COVID, the virus, in the vaccines. That is not accurate, so there isn't the COVID virus in the vaccines. What there is a protein that looks like the virus that trains your immune system to be able to recognize the virus when it comes into contact with it. So basically what it's doing is telling your immune system, the part of your body that kills off viruses and bacteria, what to recognize and what to notice when it comes into contact with the COVID virus. The way that that works for your body is that it sees this protein, it sees this little part of the virus, and it automatically recognizes, because it's seen it before, that this is something dangerous. So your body's able to very rapidly have a good immune response and to kill it off. So you won't get COVID-19 from the vaccine. You don't get COVID-19, the virus, from the vaccine. It just trains your body to recognize the virus if you do come into contact with it. I know also some people are worried about the possibility they might test positive for COVID-19 if they've been vaccinated. Again, that's not accurate. So you won't test positive to COVID-19 if you've had the vaccine, but you will be able to have a good immune response if you get exposed to the virus. That's a fantastic question, and I think the reality is that all of these things that we're getting used to doing now, which is washing our hands, social distancing, all of that is going to be a part of our lives, at least for the next few years, and maybe even longer than that. The reason for that is that there will be some small groups in the population who may not be able to receive the vaccine, either because of allergies or other health reasons that mean that they can't receive it. And therefore, we want to be able to really try and protect those vulnerable people in the community. And the best way to do that is by wearing masks where appropriate, washing your hands frequently, and staying that 1.5 metres apart is really important too. So I think once you've had a vaccine, it's not going to be a green light to go back to life exactly as it was before, but it will give you the confidence that you and your community are protected from getting unwell from COVID-19.